Cambridge Technical, Unit 1, Building Positive Relationships in Health and Social Care. This is for the learning outcome 4, Communication Skills. PowerPoint 8. Here is the grading criteria for learning outcome 4. There are 2 passes, 1 merit and 1 distinction. The 2 passes require you to demonstrate effective communication skills in a one-to-one interaction and a group communication. So basically P4 and P5 will be you undertaking that communication, be it in a role play or during your work experience. M3 will be reviewing how effectively you carried out both of those interactions. And D2 will be justifying the use of reflective practice to ensure interactions build positive relationships. This learning outcome will be looking at effectiveness of interactions. So, how do you use communication skills that you've learned? And how can these have a direct effect on relationships of individuals and others involved in their lives? Across health and social care and childcare, you'll need to work with a range of different people, and they all have their unique needs and preferences. Lots will have different communication needs that you will need to adapt to ensure that they understand. If they're not understood or taken into account, then misunderstanding can arise and it can make interactions difficult and very unproductive. It also means that the quality of relationships can also be affected. For P4 and P5, you'll be videoed carrying out a one-to-one and a group communication. This has been adapted for lockdown, and when you'll be able to see how it has changed in your lockdown Learning Outcome 4 booklet. Your teacher will also complete a witness observation form, which you will use to help you review your demonstration. You can also use any peer feedback that you have been given. So you're expected to demonstrate that you can carry out an effective one-to-one communication. Look at the scenarios below. You can pick one of the following scenarios to choose for your one-to-one. Additionally, I've put some extra ones in the lockdown booklet. For P4 and P5, one-to-one communication and group communication, you could have, for the one-to-one, a healthcare scenario. So part 1, Joe or Joanna has an appointment with the nurse at his or her local doctor's surgery about contraception. Joanna is unsure what the best methods of contraception for her, as she is in a long-term relationship with her boyfriend and is wanting something other than condoms. So that's one that you could use. I've also given you a social care and a childcare. Again, there is an additional 2 inside the lockdown booklet. Next is group communication. Here are some examples of a group communication that you could do your group role play on. There are additional ideas inside the lockdown booklet. Task 1, one-to-one and group communication. Firstly, select a partner for the one-to-one, or your teacher will place you in pairs. 2, select a group or be placed into a group for the group communication. A group constitutes 3 or more people. Choose one of the scenarios you would be most interested in role-playing as a one-to-one and as a group. So discuss with your partner and with your group which ones you think are most appropriate. Then I need you to think about the following. What communication skills would be most effective in your communication? How are these used and why? What effects do you think these skills have in building positive relationships in these communications? Communication skills. Refresh your memory of all the communication skills that can be used to build positive relationships. This may mean going through past notes, checking past assignments. Have a look at verbal communication. Make sure you know the difference between tone, pitch and pace. Make sure you're aware of what age-appropriate language is. Ways in which you can avoid slang, acronyms and jargon. Consider non-verbal communication, how well you can maintain eye contact, body language, gestures, facial expressions, sign language, etc. And for written communication, think about the ways in which you can communicate with someone by writing. For example, there are reports, plans, records, care plans, which should be written in clear language and accurate descriptions. Whilst you're carrying out your one-to-one and your group communication, you will need to be observed and a feedback sheet completed on you. For M3, you will need to reflect on both of your role plays, and for each one, review how effective the communication skills that you use were by answering the following questions. So you can use your feedback sheets that you are given after your one-to-one and group to help assist you with this, and any feedback provided by a witness observation. 1. What communication skills did I demonstrate in the one-to-one? Why did I use these communication skills? How did I feel I was using these communication skills? What went well and what didn't go so well? You must include what didn't go so well. It's important to place in your assignments what didn't go as well as those that did, so that you show you can identify when things aren't going quite well, and then you can justify ways in which you could improve in it. So number 6 as well, what did I learn? Tips. Make sure you clearly state which role play that you're reflecting on. So it might be worth reflecting on the one-to-one first, followed by the group communication. Ensure that you've provided detailed evidence about the effectiveness of your communication skills. So as a class, prior to undertaking your role plays, you will need to devise your own observation record sheet. If you look on the right-hand side, this is one that I have produced and made. This can be used to look at the forms of communication which you've used, verbal and non-verbal, other aspects that should be observed, written communication. And this is a sliding scale 1 to 5, so 1 being ineffective, 5 being effective, and also leaving space for comments, which should help you then review how well you did and areas for development. I've also produced a tick support sheet for students with M3, and this can be used to rag rate how well you have done, and also you can tick it off when you have completed it and you have reviewed all these aspects. So for 3.1, you could look at how well you've identified the communication skills that you've used, look at whether you've described what went well, what didn't go very well. And again, you do that for the group, so you do one-to-one and then you do group, looking at concluding how your interactions went, and also what you would do in the future if you had to carry out another one-to-one and a group communication. So this support sheet is really effective in making sure you've included all the relevant content. So a little bit more about self-awareness and reflection for M3. It is important that you learn from your role plays. It is expected that it will not be perfect, and that is good because it gives you something to talk about. And having that to talk about, you can actually show how you can improve, which will then get you the higher marks. Try to think of why you might have done something well and why you might have done something not so well. Identify good practice and what needs to be changed for next time. For the last distinction of this unit, you will be expected to complete your report by justifying the use of reflective practice to ensure interactions build positive relationships. So you will need to answer why it's important to reflect on practice. What could you have done better next time? What strategies could you implement to help you improve next time? So you could say things like videoing your performance and watching it back, getting colleagues or peers to observe you, also completing sheets on your performances, so feedback sheets. And number 4, what developmental needs or training do you think you might need for the future? These are all vital in helping you secure the higher grading criteria of distinction. Use of strategies, support and aids to overcome barriers. It's important you have people witness and feedback on your role plays. It really will help you see, wow, where you're doing really well, and hang on, this is an area that I can improve on. It's important to see how you could affect others. So someone identify now that you aren't very good at eye contact and that you're constantly looking at the ground could help you in the future. So you could, because otherwise, if you're not looking at someone, it could come across that you're being rude or disrespectful. So highlighting that earlier can give you the opportunity to improve upon it so that you don't repeat it in real life. Have a think about the ways in which your communications could improve in the future. What strategies could you implement to make sure that in the future, when you're working in health and social care or childcare, Your one-to-one communications are as effective as they possibly can. Here are some examples of some strategies that you could use. For example, training and development. You could attend training courses. Video performance, so videoing yourself, looking back at it and self-reflecting. Undertaking work experience, so getting used to work with people with different needs. Practicing more role plays. Getting somebody to watch and feedback. Completing another feedback sheet, perhaps a more detailed feedback sheet. Speaking to a professional, someone that's a nurse or doctor for advice. Watching YouTube tutorials. And you could practice things like eye contact or body language, even talking to parents or family members around the home. This PowerPoint was produced for my class. I've placed it on YouTube to help other people if they need it or if they're covering the same content. Please can I ask you to subscribe, because I am trying to produce more videos and pop them onto YouTube so that they can be helpful with other practitioners or students on their health and social care course. Also, any feedback's also appreciated. Like I say, I only complete these for my classes, but if you think there is something that I could do better, or something that you're enjoying or I'm doing well, please let me know in the likes, in the comments sections. Thanks very much.